Yeah.
Go JaMarcus. JaMarcus. You seen that video?
Hold on, we gotta clean up this trash.
I was looking at you and you was looking at me and I was thinking. Boom, 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 boom.
Go to Marcus. Go to Marcus. Go to Marcus. Go to Marcus. Go. Go. Who is that? Oh.
I was looking at you and you was looking at me.
This is Maria. This is Jocelyn. This is Tiffany.
That's for real.
This is Mackenzie.
It's
That's
is-
Jocelyn. Jocelyn, I like Jocelyn's hair.
No
That's
telling.
Tiffany.
And that's Jennifer.
Keep y'all
Ain't
something
no-
there because we're about to remove these staples.
Everybody else, they in the clinic. Who in the clinic? Tavaria and Giselle.
That is,
We're missing Leslie.
Vanessa, she always recording.
Hola.
Yeah.
Alright, who wants to do this beside me?
Me.
We recorded. I recorded this, so I got to.
No, I'm talking about X. Come on, Tiffany. You beside me.
Oh.
You gonna do it too?
Yeah.
That's that.
You burn my sled?
Yeah.
Yeah.
Obviously. How you gonna do it?
That's what like my mom gave my friend on Snapchat.
Do you don't?
So these are the utensils.
I was looking at you,
Why?
you was looking at me, and I was thinking.
Scissors.
Go Tiffany. Go Tiffany.
Oh, y'all gonna be on this side. No, they're gonna be sitting over there.
Tiffany, what size gloves you wear? Oh, you're gonna get those on. Yep.
See, they go
Go on
the
my blue
strips
bag over
right
there.
there.
I think I know you did all.
They go around.
That's white.
Ain't no telling.
From the,
I didn't see my rocket coming in.
Ooh. Ew.
Hey, girl used to pose like
Ooh.
Now you remember how girls used to pose? Oh God. Or them the lips.
The
The
duck
ones with
lips.
it's like this. Or this one.
I used to be like this.
The Tiffany, you like she used to say. She used to talk to all.
Alright, Mackenzie, you want to record for me?
Yes.
Do me.
Y'all can too. Come around.
Ooh. On the other side.
I was looking
This
at
is
Tiffany. Looking at me.
Dr. Norris. Correct?
Yeah.
Yes, it is.
Señorita.
So how's your days going so far, them blondie? I wish I was French.
I wish I was.
I would never be
I wish I was a real American.
I wish I was at home.
Oh, have y'all watched? Y'all ain't watched All American yet.
No, we like to.
Yes, I'm caught up. I'm trying to see who got in the car wreck.
The girlfriend.
Wait.
Why would you do
Wait.
Ooh.
It ain't even came out yet. I'm just saying, like the preview.
See the preview.
Somebody finna die.
Is my flash on?
They
Oh shit.
Alright, let me know when you're ready. Hold it steady.
been ready.
You already watched it?
With two hands, girl.
Okay, hold my phone. Record on my Snapchat. Oh, it's recording.
Alright, so we're going to demonstrate a suture removal with surgical suture remover. So before we do that, let's look at everything that we have. So we're going to use our paper as our sterile drape. And then we have our iodine swab stick. We have our tweezers. We have our scissors. We have an alcohol prep. Wait a minute. You see my scissors, cuz? Hold on.
What happened?
Roses.
Oh, them big ones.
Vanessa, cut that out.
I stopped it. Do you want me to restart the video?
Yeah, you can start it, or you can delete it.
Tiffany over there
Bloopers.
look like that. Okay, I'm gonna start it.
Okay.
Can you want me to close?
All right, so we're demonstrating our suture removal. We've already taken all of our contents out of this package. So we have our paper used as our sterile drape. We have our iodine swab stick, our tweezers, our scissors, our alcohol prep pad, our gauze, and we have sterile gloves. We have sterile strips that we've already cut. And so what we're gonna do first, before we start the suture removal, we gotta make sure that we always have a doctor's order. After that, we're gonna explain to the patient exactly what's going on, and then after that we're going to perform it. So first things first, we're going to look at our skin And we're gonna make sure that there's no signs of infection. So we're gonna make sure that there's nothing swelling, nothing red around the suture site. We wanna make sure that there's nothing that's oozing out of it. If there is, you gotta make sure that you put a wet dressing on top of it and make sure you notify your provider. All right, so we're gonna first don on our sterile gloves. We've already performed hand hygiene. Let me stand up. All right, so I grab my sterile gloves with my dominant hand.
Don't touch.
All right, 2 fingers up under here. All right, so now we're ready. All right, we're gonna open up our iodine swab.
She don't have one.
See, hers already open. All right, open this up. We're not gonna use this because it's fake skin, but we're gonna simulate using our Q-tip. All right, so we'll take our Q-tip and we'll look at our site and we'll clean down the suture site. Discard that one. Use our other Q-tip. Clean down that suture site. Make sure it dries. All right, we're gonna place our gauze up under our patient's skin because we wanna make sure that we get all sutures and so we can count at the end. All right, so with our dominant hand, we're gonna grab our scissors. And with our less dominant hand, we're gonna grab our tweezers. Okay, so when we're removing sutures, we wanna make sure that we cut closest to the knot. Whatever the knot is closest to the skin, that's the part we wanna cut. So we're gonna start at the bottom one, use our tweezers to pick up the knot, and we're gonna use our scissors to cut at the closest part of the skin. Got it? And after that, instead of pulling or tugging, we're going to pull the suture towards us because we want all of it to come out. All right? Once it's out, we're going to lay it on our gauze. And we're going to remove sutures every other instead of in a straight line because we do not want to cause a wound to become dehisced, which means that the wound will come out. So instead of starting at the next one, we're going to go to the second one. We're going to pick it up by the knot, cut the knot closer to the skin, and then we're going to pull it towards us, and then we're going to lay it on our gauze. After we do that, we're going to cleanse our site again. Cleanse it, cleanse it. Allow it to dry. And then we're going to use our steri strips to apply to the skin. All right. And so then after that, we'll repeat the first steps that we did before, removing the other sutures. We'll remove the other 2 sutures, cleanse the site, wait for it to dry. We'll apply our steri strips, and that will be it as far as removing all of our sutures.
You have to do a
Kill. All right, let's move these staples right quick.
Let's move. Let's move.
Yeah, let's remove them.